there is a cuff impulse which leads to a defect of around 3.5 centimeter. So the plan is to make 3 small holes on the abdominal wall, 3 small holes on the abdominal wall through which we are going to correct the hernia which is seen in the center. This is the abdominal cavity and this is the abdominal wall musculature, and this is a defect in the abdominal wall musculature which is seen in the form of a hernia. We have done a suture closure laparoscopically, and the hernial defect which was existing here is now gone. This is a dual layer 15 centimeter diameter mesh. We are going to insert this via the small hole . Surgery has been performed through 3 small holes. This is Dr. Rohit Shool from Healing Hands Clinic. Thank you. Surgery has